Does magnesium cream actually work for relieving muscle and joint pain? The honest answer might surprise you, so let's look at what the evidence actually says. Magnesium is a mineral your body genuinely needs. It plays a role in muscle contraction, nerve function, and hundreds of other processes. So it makes sense that people have started wondering whether applying it directly to the skin could help with pain. But whether it works as a cream is a very different question. Magnesium cream typically contains one of two forms of magnesium salt, either magnesium chloride or magnesium sulfate. The idea is that these are absorbed through the skin and reach the muscles and nerves underneath. The problem is that skin absorption of magnesium is limited and variable. How much actually gets through and whether that amount makes a meaningful difference is still scientifically uncertain. People commonly try magnesium cream for things like muscle soreness after exercise, cramps, fibromyalgia, chronic low back pain, and restless legs syndrome. Some people do report finding it helpful, but when we look at the clinical research, the studies are generally small, not well designed, and the results are inconsistent. It's also worth knowing that placebo effects can account for a meaningful portion of perceived benefit in pain studies. So feeling better after using a cream doesn't always mean the cream itself is doing the work. Here's something important. Magnesium cream is regulated as a cosmetic product in the UK, not as a medicine. That distinction really matters. Cosmetic products haven't gone through the same rigorous efficacy testing as licensed medicines, and NICE, the body that sets clinical guidelines in England, does not currently include topical magnesium among its recommended treatments for common pain conditions. For osteoarthritis, NICE recommends topical NSAIDs like ibuprofen gel. For localized neuropathic pain, capsaicin cream has more evidence behind it. So what does this mean practically? Magnesium cream is generally considered well tolerated. Most side effects are mild and localized, things like temporary tingling, mild redness, or itching. Staining on clothing is also possible, so that's worth being aware of. Always follow the instructions on the specific product label and avoid applying it near your eyes or mucous membranes. There are some situations where you should be more cautious. Avoid applying it to broken skin or areas affected by active eczema. If you have significant kidney problems, speak to your doctor before using it. And if you're pregnant or breastfeeding, check with your GP or midwife first. If you're considering magnesium cream as part of managing a pain condition, it's worth having a conversation with your doctor or pharmacist. They can help make sure you're not missing out on treatments with stronger evidence behind them. Persistent or worsening pain always deserves a proper medical assessment. And if you've been using magnesium cream for a couple of weeks without improvement, that's a good prompt to go back to your GP. If you notice a more significant skin reaction, stop using it and seek advice. So to recap, magnesium cream contains magnesium salts applied to the skin, but the evidence for meaningful pain relief is currently limited. It's regulated as a cosmetic in the UK, not a medicine, and it isn't included in NICE guidelines for pain. It's generally well tolerated, but it shouldn't replace evidence-based treatments. This video is for general information only and isn't a substitute for medical advice. Please speak to your GP or pharmacist for guidance tailored to your situation. Have you tried magnesium cream or are you considering it? Let us know in the comments. We'd love to hear your experience. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more honest, evidence-based health content.